cancer you can't be screened for. Sometimes it just pops up on you. But there is screening for colon cancer. Recently, they have lowered the age from 50 to 45, which should have been done, especially for people of African descent, but it's lowered for everyone. It's important to know that colon cancer screening does not necessarily mean a colonoscopy. You can get screened for colon cancer with a stool test. Now I know, because I talk to people about this every day, folk don't want to be playing around in their stool. It's not really playing around. The instructions are very simple. You put some stool on a card and you mail it back. And that's it. From that test, it can be detected whether you have blood in your stool, which you should not, and determine whether you need to get further screening. If you have a family history of colon cancer, you would get screened sooner than age 45. You would get screened at least 10 years younger than your family member was when they were diagnosed. And this is a first-degree family member, mother, father, sisters, brother. So if your brother got colon cancer when he was 42, you need to get screened at 32. Okay? I think that's all I'm going to say about that, but I just wanted to touch on that. So back to COVID. The question was, what are the new guidelines for COVID from the CDC? Update on COVID-19 and the variants. So you guys probably know as well as I do, the CDC keeps changing. The guidelines consist of guidelines for vaccines, guidelines for masking, guidelines for isolation, okay? The vaccine guidelines are not changed, get vaccinated. There's actually another new vaccine that's scheduled to be approved soon. It may help some of those who have not been vaccinated get vaccinated, because it's not the messenger RNA kind. It's one of the traditional vaccines made from proteins. And they're using it, I think, in Australia right now and some of Europe, but it has good results. So that one is supposed to be approved soon in the United States. So hopefully that'll close the gap on the people who have not been vaccinated. As far as boosters, right now the recommendation was for one booster to your vaccine. I know that Moderna has asked for approval for another booster. So that might be coming soon. Not sure when. As far as if you get COVID or you're exposed, you have a close family member with COVID positive, the recommendation is to isolate for 5 days. So you stay home for 5 days. For the next 5 days, that's days 6 through 10, you are still expected to do strict masking, where you're wearing your mask around other people. But it doesn't mean you have to stay in your house anymore. This is all subject to change. I noticed that, for instance, the schools where we live are no longer requiring the students to wear masks. So a lot of it is going to go down to personal choice, because we're in uncharted waters and no one really knows what's going to happen with COVID next. We don't know what variant is going to come out next. We don't know how virulent it's going to be. And COVID is here to stay. I don't think that this is something we're going to eradicate and never see again. I think we have to learn how to live with it and conquer it so that it's not controlling our lives. And if that means getting more boosters, I'm ready, and I cannot stand needles. So I'm just going to tell you, if I'm willing to get a needle, it's really important to me. because I'm one of those that has to put my head down like this and look away and just pray till it's over. If you get COVID and you're in the isolation time, all there is, now there's monoclonal antibodies. So if you really feel sick, you can get treated. And there's even some oral medicines for COVID, but I have not seen them where I work yet. But there are oral medicines that you can take. But for the most part, you're going to treat your symptoms. So if you got a stuffy nose, you take something to decongest. If you got a headache, you take some ibuprofen or Tylenol. You rest. There are some theories that increased amounts of vitamins like vitamin C or zinc help you. Zinc is known to combat viruses, so it makes sense to me. Vitamin C is an antioxidant, so it's going to help you. So those things are things that you can add on top. But mostly it's rest and it's isolate and don't re-expose yourself. The next question was really about self-care, because we were in the new year, and just what are some ways to improve overall health. I guess it's a hard question, but it's an easy question. And it comes back to what I titled it, self-care. So you have to take care of yourself in order to improve your overall health. So that would include eating right, getting your mind right. So that means surrounding yourself not with negativity, having positivity around you, doing things that you like. It would include moving your body, otherwise known as exercise. It would include eating right. Eating right is different for everyone. I was taught and used to recommend that people eat small amounts frequently, because that has been shown to help you lose weight if you're trying to. Decrease hunger, because when you get hungry, you overeat. But there's also a school of thought that intermittent fasting works just as well, where you choose a window of time during the day to eat, an 8-hour window, 10-hour window each day, and the rest of that 24 hours you don't eat. You can still drink water, and that goes back to one of the overall health improvements is to drink water, plenty of water. Sleep is a good part of this, because if you don't have enough sleep, then you don't have that sharp mind, you don't have the energy, and you can't function as well. So one of the things about sleep is sleep hygiene. I don't know if you've heard that term before, but as physicians, we always talk about sleep hygiene, especially starting with the young ones, with the young kids. But people who have to work, people who their sleep is important, and it looks like a routine. So what is your evening routine? What is your nightly routine that you have to prepare yourself to go to sleep? Whatever that consists of, if it's skincare or journaling, whatever that particular thing is for you, that can be part of it. The important things to include in your routine is to avoid caffeine and alcohol close to bedtime, because they're going to impair your sleep. You practice the self-care and stress relief activities all throughout the day as well, because then you're more relaxed when it's time to go to bed. You want to block out excessive light with either blackout curtains or even a sleep mask if you need it, because the light is sending signals to your brain to stay awake. So you need darkness. And you try relaxation techniques such as meditation, prayer, deep breathing exercises. The important thing is you need to turn off technology because that's light, at least an hour before bedtime, because that stimulation is continued there. Okay. Sometimes you can't avoid stress and anxious thoughts, even with the prayer and the meditation. And the important thing to know is if that is something that's overcoming you or impairing you, then you need to seek help. Okay? And that might mean therapy for you. It might mean medication, not necessarily a sleeping pill, but something to help you manage the anxiety and the stress, which I'm going to talk about stress in just a moment. It might even be the next question. So that is sleep. Yeah, stress. Okay. Someone asked, what does stress do to the body's organs? And the next question about stress was, what are some methods to handle it? And then, how do we learn to identify its triggers? Okay, so that's a lot. First of all, what does stress mean? And I found that it means something different to everybody. And I was trying to find like an official definition, because that's what I'm here for, to try and find official stuff for people. And one of the definitions that I found, if I can find it, sorry. Stress is the body's reaction to harmful situations, whether they're real or perceived. When you feel threatened, a chemical reaction occurs in your body that allows you to act in a way to prevent injury. This reaction is known as fight or flight. You've heard of adrenaline, and that's the stress response. So during the stress response, your heart rate increases, your breathing quickens, your muscles tighten, your blood pressure goes up, because you're ready to act, because you're ready to protect yourself. So that's what the official meaning of stress is. But stress means different things to different people. So what causes me stress is not going to cause you stress, and vice versa. So we have to find out what our own stressors are. And the best way to do that is kind of retrospective thinking. So when you have that stressful incident, you have to look back to see what happened to make you feel that way. So some of the symptoms of stress is emotional symptoms. You can become easily agitated, frustrated, moody. You could feel overwhelmed, like you're losing control, or you need to take control. You have a hard time quieting your mind or just relaxing. It can also show itself by low self-esteem, feeling bad about yourself, feeling worthless and depressed, and avoiding others. A lot of this, so stress, when I'm looking at it from a medical standpoint, it can mean anxiety or depression, or anxiety and depression. And I'm pointing that out because when I worked in San Francisco, I often had people come to me and wanting me to fill out FMLA, Family Medical Leave Act papers, because they're stressed on their job. And when you fill those papers out, you have to have a medical diagnosis. I can't just say they're stressed out. So I start asking questions about, is your sleep impaired? Are you moody? Does your heart race, when you get in these situations? And it turns out that, the medical term is either anxiety or depression or both. And when it's just something that's temporary, that's caused by circumstances, they call it adjustment disorder. Because that means it's not this permanent thing with you. It means you're adjusting to some change that has happened, and so you're experiencing anxiety and or depression. Okay? So some of the physical symptoms are low energy, headaches, upset stomach. Some people feel everything in their stomach. I'm one of those people. You know, when I feel good, I feel it in my stomach. When I feel bad, I feel it in my stomach. Everything's in my stomach. But you can get upset stomach, you can get diarrhea, or the opposite, you can get constipation, you can feel nauseous. And all of these can be symptoms of stress. You can get just overall aches and pains and muscle tenseness. And that's because, you know, you're bracing yourself a lot. And so your muscles are tensing up. The one that alarms people the most is chest pain, because we don't know that chest pain is anxiety. We have to make sure that it's not a heart attack, especially in people that have risk factors for a heart attack. So I see when I'm reading like emergency room visit notes from my patients where they came in with chest pain, you know, it was, oh, my chest is hurting, my heart is racing, everything, and they do all the diagnostics and the heart is fine. And so then the next thing you look at is what else is causing this kind of reaction? And so it can also be stress. And then one of the physical symptoms of stress is also insomnia, not sleeping. You can get frequent colds and infections when you're stressed because it lowers your immune system. You get loss of sexual desire. You get nervousness and shaking. Some people get ringing in their ears, or the clammy, sweaty hands and feet, dry mouth, hard time swallowing, clenched jaw, and all of that is just because we're not handling it well. There's cognitive symptoms of stress, so worrying, racing thoughts, forgetfulness, just unable to focus or poor judgment. And then behavioral symptoms are change in appetite, procrastinating and avoiding responsibilities, more use of substances like drugs or cigarettes or alcohol. And then nervous behaviors like nail biting, you know, fidgeting, pacing, those increase when you're stressed, all right? And some of the consequences of long-term stress are, as I mentioned, mental health problems like depression and anxiety, cardiovascular disease, because as I said, when you're stressed, your blood pressure does go up. And high blood pressure is a risk factor for heart disease. You can get abnormal heart rhythms, obesity, or other eating disorders, because if your appetite is affected, a lot of times you eat when you're not hungry because it's somehow comforting you, and that can increase your calorie intake, therefore lead to obesity. Skin and hair problems, acne, and then stomach problems like too much acid on your stomach can cause gastritis, which is the irritation of the lining of your stomach. And then some colon things like irritable colon, where you alternate with diarrhea and constipation. So the important thing to know is that stress is a part of life, but what matters is how you handle it. So the best way to handle it is to know what your stress symptoms are, because then you can catch it before it becomes overwhelming. The next question, I just put under general health maintenance, the next two. One says, do we really need a physical every year? The short answer is yes, with an asterisk. So I used to work for a company that wanted to reimagine the yearly physical because they thought that it was not useful. We've come to expect at this yearly physical that, you know, the doctor's going to check you from head to toe. They're going to look in your ears and your eyes and look in your throat and use the reflex hammer and, you know, have you squeeze, get the muscle strength and all that. A lot of that is for show. We do it because y'all expect it. It's not really helping the diagnostics. It's just, it's telling us something, but it's not leading to diagnosing and treating. Okay? What's more helpful at that yearly physical is the history. So all those questions, it sounds like the doctor just keeps asking you, and my goodness, you asked me last time about my stress level. You asked me, do I smoke? You asked me, how often do I exercise? You know, you asked me about what they call the review of systems, where it say, are you having any headaches, blurry vision, sore throat, you know, neck pain, heart racing, chest pain, shortness of breath, you know. And when I do it, the way I remember the review of systems is I go from head to toe and I just look at you and I say, you know, I look at your chest, and so I say chest pain, heart racing, you know, stomach pain, nausea, vomiting, diarrhea, constipation, and I just go on down so that I can remember. But that review of systems gives me a jumping off point, because when you have a positive, then I know that I need to concentrate on that thing. Okay. The other thing that we do that is useful every year is the lab work, the blood work, because we can't see that on physical exam. And the most important thing is to know your numbers. And I know I've spoken about that lots of times. You got to know how close you are to diabetes, or if you have diabetes, you need to know how controlled your diabetes is. You have to know what your blood pressure is, and are you at risk for high blood pressure? Do you need to monitor it more often? Do you need to drink more water? Do you need to increase your aerobic activity? You need to know what your cholesterol is. You need to know that if your good cholesterol is too low, that you can increase that by just moving your body aerobically a little more often. So that's the one that's like Pac-Man, and it will help to eat up the bad cholesterol. So HDL is the good cholesterol. If it's too low, which it commonly is in males, then just increasing aerobic exercise works better than most of the medications out there. It does not mean, I am not telling you don't need to take your medicine, because if we don't have a doctor-patient relationship, that is not my place. But I am saying that you can assist your medicine greatly if you do some aerobic exercise. And that doesn't mean you have to take up running. It means that, you know, if you do nothing every day, then you start walking for 15 minutes, because your body will recognize that as something different. The other thing so the things that are important, and the reason we do the physical exam is because of the history, because of the labs. And then the physical part is important because we can't know that you have an irregular heartbeat if somebody doesn't touch your chest with the stethoscope. That's something that's actually heard. You know, if your stomach is poofed out and distended, you know, I can see that. But if I touch it, I can know whether I feel like that's air or that's a tumor. Okay? So there's other things that happen with the physical exam. So I looked up, because I wasn't sure what the current recommendation was, and it said people over 65 definitely need a physical exam every year. Okay? People from 19 to 21 need a physical exam every year. I don't know why. Children definitely need a physical exam every year, and under 2 you need way more than that. Okay. But then when you get between that 21 and 64, the recommendations were varying between 1 to 3 years. So I would say, to be safe, we're going to just say yes, you're needed every year, and let your doctor say, I don't need to see you next year. You come back in 2 years. Just come get some labs or something like that. Okay. The other part to this question was, how often should we get a vision and hearing checkup? So vision exam is recommended every year, every single year. Even if you have perfect 20/20 vision, never worn glasses ever in your life, it is recommended that you get a vision check. Hearing is not so cut and dry, but if you can't hear, you should go get your hearing checked. If somebody says they have to talk to you multiple times, they have to keep calling you, or you're saying, huh, a lot, pardon me? Repeat that, huh? Then you should go get your hearing checked, okay? And sometimes your hearing's gonna be normal, even though people say that. So if it's not wax in your ears and your hearing is normal, but you're still saying, pardon me, huh, and people are having to tell you often, that's a concentration thing. And that might go all the way back to that stress kind of thing. And you might want to look at that and look at focusing and concentrating and doing some kind of mind exercises to help that out. The last thing that was asked was addictions. And the question was, are they disease? The answer is yes, for sure. And I could just stop with that, but it's not me. So I found a definition. Addiction is a chronic disorder with biological, psychological, social, and environmental factors influencing its development and maintenance. Okay? About half the risk for addiction is genetic. Okay, so addiction runs in families. Genes affected the degree of reward that individuals feel when they get a substance. So let's use cocaine as our addiction. Okay, if my mama was addicted to cocaine, and I'm somehow exposed to cocaine, my degree of appreciating cocaine and wanting more of it is going to be different than you whose mom was not addicted to cocaine, okay? But that's only part of it. The other part is not genetic, okay? The chronic use, the exposure, environmental factors, whether it's accessible to you, whether it's, by accessible I mean whether it's physically accessible to you or financially accessible to you, can influence the behavior. Addiction is often influenced by stress or psychological factors, the history of trauma. It's influenced by social factors, like if your families or friends are using the substance, you're more likely to try it out and use it, okay? Gambling is an addiction, so it's not just drugs. Eating can be an addiction. Video games can be an addiction. Alcohol. So we want to make sure that we're not leaving some things out because we think this just means drug addicts, okay? Because it doesn't. It means all of us have that potential for behavior to become addictive. If it's, did I forget cigarettes? Yeah, cigarettes, nicotine definitely is addictive. So, and there's also addictive sexual behavior and spending. Okay? So it's an addiction if you can't control it. It's out of control. You can't just tell yourself to stop spending, or distance yourself from the internet where you're spending. You find ways to get back on. You find ways to eat more cake. You find ways to get your drug or your alcohol. There's help for all kinds of addiction. I would start with your whoever your primary care provider is, and once again, you have to have a relationship that's good enough for you to confide in them and let them know that this is an issue for you, and then have them help you to find some help. The self-help groups like Alcoholics Anonymous, Gamblers Anonymous, Narcotics Anonymous are actually very helpful. Nicotine support groups where everybody in the group is trying to quit together are actually very helpful. I can remember going to some Narcotics Anonymous group meetings with my sister who was addicted, and it's memories that I'm never going to forget because of the amount of support that she received from people who were going through the same thing. That is the end of the questions that I had. If you guys have anything that you want me to touch on or go circle back to, please let me know. Yes, ma'am.
What would you suggest if your clique, like some of your family members and some of your friends, they don't get the right information about the COVID?
Mm-hmm.
You know, I got some in my clique, some in my family, they will not get it.
Mm-hmm.
They won't get the shot. And they're not gonna say or do.
So,
You know, but they around me, I got under 9-ish or whatever. And my doctor's telling me that I got to be really careful.
okay. So number one, I would suggest that you stay masked whenever you're around them, and you stay in not these kind of masks, but you get you a KF94 or KN95 mask if you can't find an N95. And when you're around those people, you protect yourself. So that's the first thing. The other thing is, some people do have the right information. They have just chosen that they don't believe it, they don't want to believe it, they don't want to do it. So if it's that they really don't have the right information, tell them to go to Facebook and look at the old videos, because I think I've talked about COVID every week. I mean every month, every time I've been there, and they can even just listen to the service from the third Sunday. You know, start with the third Sunday of October and keep going. So if they're willing to have more information, that you can certainly share the information that I have. The other thing is, find out who they trust. Like who is their trusted person that if that person tells them they need it, they'll listen to. Because it's not you, because you've been telling them, right? So you have to find out whose opinion they value. But first and foremost, you have to protect yourself, because there's people who are never going to get vaccinated. They're not going to get vaccinated. They could have been spreading it all for the last 2 years, but you're not going to be able to convince them that they have been. And I see people every single day at the job who I just choose not to discuss it with them anymore. Not people who work there, because you can't work there unless you've had the vaccine. These are the patients that I'm seeing, and they come in. They're ready. They want to debate, you know, their conspiracy theory that they found on the internet, and I'm not here for that. You know, I'm going to follow science and I'm going to follow the evidence, because we've seen that when people got vaccinated, the numbers went down. Now, let me just say this, because I know I didn't say it. The variants are going to continue. Okay, that's how viruses work. They mutate. So there's going to be another variant that comes out. I don't know whether it's going to be a variant that's like Delta was, which we don't want, or one that's like Omicron that's just infecting everybody but not making them really sick. But there's going to be another variant. I think there already is one, but we haven't. Which one?
In Europe.
Yeah. And so we just haven't heard much about it here yet. Does that answer your question?
Yes.
Okay, you're welcome. Yes, sir.
Can you repeat that type of mask you
KN95, KF94. So those masks filter 94 to 95% of the particles. Okay. And I saw KN95s at the grocery store the other day. So they've begun. At the beginning of this, we used to have to order them on the internet. That was like the only way you could find, the better masks. But now they're selling them everywhere, and just have a few for those special occasions. All right. Oh, no. Yes, sir.
Stress.
Uh-huh.
Can stress affect people that have arthritis?
Yes, sir. Because if you're tensed up because of stress, the muscles are connected to the joint, and so that's definitely going to affect your arthritis. Yeah, I wish if I had the cure where I could just say, oh, here's the pill, stress is gone. Well, I'd be rich and I wouldn't be here. I'd be like on some island somewhere with no COVID, no stress. So, but yes, sir. Yes.
Is there a recommended, you were talking about sleep hygiene, is there a recommended routine that you should do, or preferred things that you should do before you go to sleep?
The recommended part is definitely no screen time within an hour. So you turn off your phone, your TV, all of that. Dark room.
Okay.
Those are the most recommended. The other ones are more personal, that you can tailor to what you need. So if you're a person that deep breathing can help, or even some people use those white noise machines. If that helps you, then that should be part of your personal routine. But I find that, like, when our kids are babies, we have these whole routines. Oh, he's got to have his bath. We read the book. We do all that stuff before bedtime, and they sleep well. But when we become adults, we ditch the routine. We just go to bed, and that's probably because half the time we've run ourselves raggedy the whole day and just go crash. But if we can establish a routine, then your sleep can be restorative. And since you pointed that out, if you're doing everything right and you're waking up and your sleep is not restorative, you need to get checked for sleep apnea. Okay? Especially if you have non-restorative sleep, you snore, somebody who sleeps near you says you stop breathing, you have morning headaches, all of that's a little package that makes up sleep apnea. So you'd want to go get tested. All right, well, I thank you for allowing me to speak again this week, and I hope everyone has a wonderful week.